All right. Welcome, everybody. We're so delighted to have you joining us for this presentation as part of the Integrated Health Sciences Core webinar series with the M-LEEaD Center. Today, we're going to be talking about the Community Engagement Core and the Stakeholder Advocacy Board, which are components of the center. And we're going to be sharing a little bit of background for you about what the Community Engagement Core is, what our core goals and aims are, and also sharing the members of the Stakeholder Advocacy Board who have been working over the last couple of years to identify core environmental health issues facing communities within Southeast Michigan. And we'll have an opportunity for you to meet the members of the Stakeholder Advocacy Board and talk a little bit with them about your own research and their perceptions and their insights from living on the ground, and many of them living in communities that are facing environmental health challenges. I'm going to be presenting a little bit here at the beginning. My name is Amy Schulz, and I'm on the faculty in the Department of Health, Behavior, and Health Education. I have the distinct pleasure of co-leading the Community Engagement Core with Barbara Israel, who you'll meet in just a few minutes. She'll be talking about a few of the slides. And I'll also be co-presenting today with Kathryn Savoie, who is the Detroit Community Health Director for the Ecology Center, and she serves as the co-chair for the Stakeholder Advocacy Board. We're going to be setting up, providing a little bit of background, a little bit of context, and then moving us as quickly as we can into small group discussions where you'll have an opportunity to talk with members of the Stakeholder Advocacy Board about environmental health challenges in Michigan. Robin, if you would move us to the next slide. This slide shows the 4 aims for the Community Engagement Core for our M-LEEaD Center. You can see them through the middle there. They are to enhance, expand, and sustain partnerships with key stakeholders within our area, to increase understanding of environmental public health among communities that experience excess environmental health risks. And our other core audiences are policymakers and public health decision makers. Our third aim is to communicate the issues, needs, and concerns of communities that experience excess risk and of policy and public health decision makers to M-LEEaD researchers in order to guide the research that is done within the center, and also to help us think about how to appropriately translate findings to community constituencies. And our fourth aim is to advance the field of community engagement and environmental health communication through evaluation, dissemination, and promotion. Those aims are derived directly from the NIEHS P30 Center critical functions that are articulated for community engagement cores, and they directly inform the work that we do as a core. You can move to the next slide, Robin. Thank you. I also want to just point out briefly that the 4 aims that we have as a community engagement core speak directly to NIEHS goals for promoting translation. And these goals are articulated in NIEHS's 2018 to 2023 strategic plan, which is the most recent strategic plan for NIEHS. For example, our first aim, which is developing core partnerships with members with stakeholder groups within the area, recognizes that strong and effective relationships between community leaders, advocates, health service providers, policymakers, and other decision makers are foundational to the Community Engagement Core's ability to translate and disseminate scientific findings and to increase our understanding as a center and as researchers based in academic settings of the issues and challenges and priorities that are faced by communities. And each of the 4 aims that we have speak to various ones of these goals for promoting translation. The next slide, I think, Robin. I also want to just comment briefly on the core principles and values that we bring to this work. And those values really are centered in the idea of partnerships, of equitable partnerships between community and academic researchers. So much of our process and much of the work that we do is geared towards assuring that there is equity in our relationships as we work together across the locations that we are centered in. And we think about equity in decision making, who has power in decision making processes. We think about equity in terms of the distribution of resources and assuring that resources are equitably distributed across, for example, community and academic partners who may be working collaboratively to address and understand and address environmental health issues. And a third arena in which equity is central is thinking about dissemination. How do we go about the process of assuring that our findings are disseminated to appropriate audiences, including but not limited to peer-reviewed publications. And a piece of this is also a commitment to co-authorship and co-presentation of work that has been created collaboratively together. And then the final point I just want to comment on this slide is that we are committed to working specifically on community identified concerns and priorities and making those a central driver of the work that we do together. Now I'm going to pass it to Kathryn, who's going to take it from here.
Thank you, Amy, and good afternoon, everyone. So I'm going to introduce you to, if I can get the next slide, to the members of the M-LEEaD Community Engagement Corps and the members of our Stakeholder Advisory Board, and then give a very brief overview of the issues that we have identified as our environmental health priorities. The co-leads for the Community Engagement Corps are Amy Schulz, who you just heard from, and Barbara Israel, who you'll hear from a little bit later. Two co-investigators who are joining the Corps are Natalie Sampson and Simone Charles. Our evaluator is Chris Combs, and Allison Walding is the project manager. Next slide. Each community engagement corps must establish a stakeholder advisory or advocacy board whose role is to facilitate and strengthen the interactions between the center and its partners. And I want to present members of our advisory board are Yolanda Hill-Ashford, Detroit Health Department, Ricky Ackerman from the Eastside Community Network, Monica Lewis-Patrick, We the People of Detroit, Angela Reyes and Cindy Gamboa from Detroit Hispanic Development Corporation, Jaye Clement from Henry Ford Health Systems, Dr. Felix Valbuena, Chast Center, Sherita Smith, Grandmont Rosedale Development Corporation, Michelle Martinez, Michigan Environmental Justice Coalition, and myself from the Ecology Center. Next slide. So these are the folks who are working together in this work. We've identified our primary audiences as organizations and community leaders who have the capacity to help us reach individuals, Michigan residents, and other communities who are experiencing excess environmental health risk. We also are prioritizing youth in our work going forward, and policy and public health decision makers in Southeast Michigan, not only in Southeast Michigan, but in other communities experiencing emergent environmental risks such as PFAS. Next slide. So as I said, we've, as a stakeholder advisory board, identified priorities for our environmental health work. And the priorities that we've identified are access to clean water. And this encompasses things like the Flint water crisis, as well as work to protect water quality and fight water shutoffs in Detroit. Air quality, which we experience from multiple sources, such as industrial facilities and car and truck traffic, has numerous adverse health effects. This area also includes concerns about how air quality contributes to COVID-19 transmission and disease severity. The next area is environmental exposures and birth outcomes. And this could include lead in homes, pollution in our air, water, and household products that contribute to negative birth outcomes. This also includes the persistent racial disparities in maternal and birth health. Climate change is a priority that we are seeing in Southeast Michigan. We can only expect to become more urgent. and which residents experience in the form of extreme weather events, heat waves, and flooding. This also includes access to clean energy and energy equity. This next area is large-scale chemical contaminations, such as PBBs and PFAS. Has not been a priority so much in Southeast Michigan. However, we include it here to reflect our broader commitment to address emergent health threats across the state. The next area, impact of environment for education and learning, includes indoor and outdoor environmental quality and air quality, especially in schools, and how the school environment affects student learning. A new area identified by our stakeholder advocacy board is gentrification, displacement, and environmental exposure. And recognizing that displacement often results from development and gentrification in our communities, and that, as we saw in the case of the Detroit incinerator, those who are these issues are closely linked, and that displacement is often the price that communities pay for improved environmental health. And, you know, as the person in the sign there says, now that the neighborhood is nice, why do I have to move? And this is the experience that what we are seeing experienced in many of our communities. So these are our priorities that we've identified as important to our community. And what we want to do now is to take a chance for us to break into small groups and have a very brief discussion, just to be able to meet with other folks who care about these priorities, either researchers or other community members. And you will have a chance to go to, Allison is going to set us up here, I think, for choosing which group you want to go to. If your Zoom platform does not allow you to see the choices that are offered, then you can put into the chat the number that you would like to go to. So number 1 would be clean water, number 2, air quality, number 3, birth outcomes, number 4, climate change, large-scale chemical contamination, number 5, environment and learning would be number 6, and gentrification and displacement would be number 7. So if you don't see options offered to you on the screen, then type the option you want into the chat, and you'll be able to join where you'll be facilitated with a group and have a chance to get to know other folks who care about this issue. And then we'll come back in a few minutes and share our thoughts and insights very briefly before we move on with the rest of the seminar.
Great. All right, welcome back, everybody. And apologies, we had such a short amount of time. We're trying to squeeze a lot into this initial conversation, but hoping this will set the stage for some more in-depth conversations down the road. So I want to spend just a few minutes and see if there are key insights, things that people might like to share from your conversations in your small groups. And I think in the interest of time, I'm just going to walk through in numerical order. So group 1, do you know who you were? Group 1 was air quality with
Water
Kathryn
quality.
and Felix. Okay.
Okay. I think we were group 2, but I think.
Oh, I'm sorry.
We'll let.
We can go first if you want. It's up to you.
Yes, go first.
Okay. So I would say as the note taker that we had representation from the community. We had representation from researchers that have significant experience working with the community, some younger researchers. And I think the takeaway from us is we need more opportunities like this to spend more time and actually talk about what's happening on both sides, both in the research environment as well as in the community, to really mesh. And there were some great examples of how that has worked in the past, to continue to develop the expertise of the academicians with the expertise in the community, to really move medical knowledge at the same time, or knowledge in general, at the same time that we're making a difference in improving the quality of life of the individuals in the communities that we serve.
Great. Thank you, Felix. All right, who was group 1? If I
Water.
Water. Okay, so group 1, water. And as a reminder, we're going to share one key insight. Felix, you handled that beautifully. And the rest of them we're going to try to capture from your notes so that things won't get lost in the shuffle. So who's reporting for the water group?
Marie, would you share from the water group?
Yes, yes, thank you so much, Monica. So our group was Monica Lewis-Patrick, Professor Gwen Winston, and Barbara Israel. So small but mighty group. And I would say I was, my personal insight was to be dazzled by the work that Professor Winston and Monica Lewis-Patrick are doing with their organizations and kind of re-envisioning human rights, environmental health issues in Detroit. So I think that just the contact and to hear about what they're doing inspired me to think more carefully about how we in academia can partner with bold thinkers who have a decades-long history of working in Detroit. So I guess my insight is inspiration and thank you to all the women in my group, because it was really thrilling to be in it.
Thank you, Marie. Yay. Okay, so group 3 was environmental exposures and birth outcomes. Who is reporting for that group? Yolanda, I think that was your group. And if somebody's trying to speak, remember to unmute yourself.
Sorry. Yeah,
Thank
I'll
you.
report for our group. Yes, the group with Yolanda. Everyone in our group were researchers who had not had much experience yet with engaging with communities, with the exception of one of the researchers. And most folks really expressed the value and the interest in engaging with communities to really enhance their work, whether that be lab work or modeling, and looking for ways to get engaged, recognizing that it takes time, that sustainability is a challenge, that there are certain challenges for junior researchers just getting started. And Trish has a lot of experience and really wanted to point out that there are a lot of great resources for getting started, including getting in touch with other partnerships that have been around for a while and have that experience and those insights to share. And she's going to also be sharing in the chat with us an upcoming movie and panel on March 16th.
Oh, thank you, Chris, and thank you, the Environmental Exposures and Birth Outcomes group. Okay, we're going to move to group 4, which was the climate change group, and that is was facilitated by Michelle and Ricky, and I don't know who's reporting out.
I don't think we decided, but I'll let Ricky go ahead.
Yeah, and we had Gabby and Amelia in our group, so we had a small but mighty group, and I think one of the I'm going to try to put our takeaways into one, but we still saw a disconnect between communities and the university, that there's still some silos forming there, and that there's work to be done to further connect community groups with what's going on at the university in terms of climate change research. And also with that, creating better incentives for hard science to incorporate social measures and disparity understanding in their research, that there's still a sort of disconnect between the hard science work being done in these areas and how we can sort of better work to sort of make it all integrated and working on the same page.
Great. Thank you, Ricky. I think really an important insight and something that we need to continually attend to and work to make progress towards. So thank you for holding that up. Okay, I think the next group was our group, which was large-scale chemical contaminations. We also did not identify somebody to report back, but Penina has very graciously put into my chat what the alignment was that we worked on, so I'll just read it. We had all researchers and 2 School of Public Health alum in our group. And one of the alignments that emerged from our conversation was that Courtney talked about some work she is doing with communities that have been affected by heavy PFAS contaminations. And she was confronting a challenge in transporting some of her specimens to the lab. It's taking too long, and she was concerned that they would not make it in good shape to the lab. And Charles Evans, who was also on the call, had some expertise that he was able to provide for her to help her think about measuring her exposures through metabolomics. So it was a very useful conversation in terms of helping to move some of the research forward. Okay, so let's see, the 6th group was the impact of environmental and school conditions on education and learning, and that was facilitated by Cindy and Natalie.
Yep.
Do you guys have a report out?
Yeah, I can go ahead and take that. So our group was also small but very mighty. We had Aurora, Dana, Rebecca, Natalie, and myself. And we engaged in it seemed very brief conversation because we could have gone on for hours. But we really started to examine just the diverse needs of students, just learning patterns for not only students K to 12, but like how that impacts students going into university settings and so forth. So it was a very diverse group. So some folks were faculty, students, and community. So like our level of engagement varied and kind of where our minds were going with this. But we all landed on just really diving into like the diverse needs of learning and the impact for the education of our communities. There was a specific lens on like the training needs, for example, educators, folks that are trying to educate our community on what's happening have to now have this unique challenge of trying to change the way they're engaging with community, right? So now it's more effort, which workshops are just not going to cut it. We have to really start to do interactive engagement with communities to break it down and make sure that it's in a language that's really easy to grasp and identify ways to continue to advocate for change in policy and things that we know are gaps right now in our conditions. So thinking about the complexity of it, right? So the needs of making sure that, the training and implementation of that is increasing, but unfortunately the funding to do that is not. So making sure that we're advocating for the needs of our community so that we can be responsive and make sure that we don't further burden disenfranchised communities, because we were talking about, whose job is it to really figure this out, right? We know that people that are living in this community, such as my own Southwest, we know what the conditions are, right? So is it the job of the residents to figure out like, how do we address the regulations and policy gaps and trying to fight for that? Or what is it that we can do collectively to make sure that it's not so heavy and people can work on this collaboratively? Thank you.
Wonderful. Thank you, Cindy. And I think that you nailed the horns of the dilemma exactly. So thank you for bringing that to the fore. And last but not least, our final group was a discussion of gentrification, displacement, and inequitable development and its role in shaping environmental exposures. And I think, Angie, you were facilitating that group?
Yes, and we were also another small but mighty group. It was Marianne Sannon Rosenberg, who is an assistant professor at the School of Nursing, and Stephen Paschal, who's a student at U of M, hoping to get into the School of Public Health, if there's anybody there that can kind of put in a good word for you, and myself. So we talked about how a lot of times people don't make the connection between corporate and development kind of projects that are being invested in a community, because we hear the positive things and how that plays a role in gentrification and displacement, and the negative impact it can have on people's health, both physical and mental health, and all of the nuances that go along with that, right? People tend to hear the positive things. I always think about HGTV every time they're fixing up houses in a neighborhood, and realize that they're also, it's nice to have those houses fixed up, but it's also creating an issue for that community, because now those houses are much more expensive, and the impact it has on the people who live there. So looking at what are some ways that you can mitigate the impact of gentrification, both policies and also things like bricks and mortar, like how do you secure healthy, affordable housing for people in a community so that they don't get pushed out, and making sure that they're protected.
Great. Thank you so much, Angie. And thanks to everybody. This was obviously a really fast pass through a set of very profound and complex issues. And we're grateful for everyone for spending some time beginning a conversation about some of these issues. We look forward to future opportunities to continue those conversations and to dig in a little bit deeper. I am going to pass it to Barbara Israel, who is going to walk us through a couple of next steps, I think, in our process, and we'll look forward to continuing the conversation from there. So Robin, go to the next slide, and then Barbara.
Thank you, Amy. And I'm going to join Amy in thanking everybody. It's great to meet new people and see familiar faces and new faces. This is something the Stakeholder Advocacy Board has been wanting to do for a long time, to reach out to center scientists and beyond, and create more connections and collaborative research opportunities. And I think this is a really terrific start. So I want to say just a few words. I know we don't have much time, about what the KEC and the SAB have done and can do to support partnerships. So particularly those of you who don't have existing partnerships, and maybe this is a newer way to think about doing research. First of all, we provide support for identifying potential partners. Often even either a community organization or an academic researcher comes to us and says, you know, we want to do research in this area, but I don't have a partner, and I'd like to do it collaboratively, but I don't have a partner. And our team, including the Stakeholder Advisory Board, sort of put our head together and try to identify, again, either researchers or community partners, and pull them together and give them an opportunity to meet each other and try to facilitate the development of a new partnership. There's also something, the Community Academic Research Network, that the Detroit URC has, if you can check that out on our website, and we'd be glad for people to sign up for that, which is an electronic way to have people's profile of their research interests, and we do sort of the matchmaking, if you will. We've also, in terms of developing and sustaining equitable partnerships, we do capacity building workshops for both academic researchers as well as community entities on what is collaborative community-based participatory research, what are communities' rights in research, and all of the training that we do is co-facilitated by community and academic partners. We have partnership development funds. This is actually something new in the grant that we hope will be funded soon. These would be $5,000 grants, 2 per year, to help partnerships get up and running. And we would provide mentorship and technical assistance to those newly forming partnerships. The pilot project funding is something we've been doing. It's part of the P30 Center pilot project funding. And there's an additional component in terms of resources, $5,000 that teams can apply for if they can show that they're going to be involved in translation work and or working in community partnerships. And we encourage researchers to come to us, the KEC, to talk about what that would look like. And we have a number of examples of where that's happened. And then the CBPR partnerships addressing environmental health research. We again provide technical assistance and mentorship to partnerships, and we have some excellent examples of this that has been going on. And if I can see the next slide and last slide. Great, thank you. So this is what's coming up over the next couple of months. We've got the 4 webinars that M-LEEaD is going to be featuring research that's community identified environmental health priorities. These are incredible academic and community teams that have been working together to promote environmental health, air quality, energy equity, water and health, climate hazards, housing, and health. So some of the very issues we've talked about today, some of the very people you've met today, will be going into a lot more depth on what these partnerships have been doing and give you examples and opportunities to think about maybe either joining those partnerships or how you might get involved in creating new partnerships to address not only these issues, but some of the other priorities, the 7 priorities that the SAB has identified. So I think we're out of time, but we're right at time maybe. So I just really, I hope you'll be able to join us for these subsequent sessions. I want to thank everybody and Allison and Robin behind the scenes doing all the technology of this, and Amy and Kathryn and your leadership's roles with the SAB and all the SAB members. Please join us again, and we look forward to staying in touch. Let us know how we can work together. So thanks everybody, and stay well. Bye-bye.